Alright, so now we are going to go over the assessment portion of Chapter 22, Gynecology. Alright, so some of the more frequent complaints that you may see, or some of the causes of gynecological problems, are also some of the same causes of just abdominal pain in general. Alright, but vaginal bleeding, abdominal pain, tenderness, vomiting, fever, tachycardia, hypotension, diaphoresis, changes in stool, dyspareunia, I ain't even gonna try to say that one, pain during intercourse, urinary symptoms, things like this. These are our changes. These are all things that could indicate potentially some abdominal issues, but also in females we want to consider the possibility of a gynecological issue as the possible cause as well. So as far as scene size up, we want to find out, is this scene safe, right? Do we need any assistance? Maybe, maybe not. It just depends on what it is. Something to think about with gynecologic emergencies is there can be large amounts of blood and bodily fluids, which means you could be at risk for being contaminated with a communicable disease, mucous membranes and all. So make sure that you're wearing appropriate PPE. Alright. Something else to think about is that you may be called to testify in court regarding some kind of scene conditions. So really pay attention to your surroundings and see kind of what's going on around you. Now we're going to make sure that we assess our ABCDEs. Expose in this part can be very important. We're going to manage any life threats, of course. We're going to provide pain management and fluid resuscitation as indicated and needed. We are not going to put anything inside the vagina. Even if there is a significant amount of bleeding, we don't pack any dressings or anything like that inside of there. We are, however, going to note the amount, the color, the type of discharge or bleeding, any clots or tissue, things like that. And then we're going to transport to the hospital. History taking with gynecological issues can be kind of tricky. You know, very few women really feel comfortable just putting it all out there, literally and figuratively. So you really want to make sure that you're being respectful and allowing for privacy for that patient so that they feel comfortable talking, or as comfortable as they can talking to you. We need to make sure that our history is going to include that chief complaint, any associated symptoms or signs. If there's vaginal bleeding, we need to find out how much, we need to quantify that. How many pads per hour, you know, how much comparison to the normal menstrual cycle, that kind of stuff. So we're really trying to get a picture, if you will, of how much bleeding we're talking about. Are we talking about just a tiny little amount, or are we talking about like it's practically gushing out? All right, some other things we want to find out. The date of the last normal menstrual period. Now keep in mind that you know, some women may have birth control methods like the IUD, or they may take birth control continuously, or implants or things like that, though where they may not get a menstrual cycle anymore. All right, and if that's so, then that's fine, but just make note of that type of birth control as to why they don't have that menstrual cycle. Is their menstrual cycle regular or not? There are apps out there that you can keep up with all of this stuff, so most women are going to be able to tell you, you know, pretty regularly when and where and what it's like and all that kind of stuff. All right, whether they are pregnant or a possibility of pregnancy. How many pregnancies have they had previously? How many have they had that went to term? Any miscarriages, abortions, any prior gynecologic problems or surgeries, endometriosis, you know, certain surgeries, things like that. Any current sexual activity, types of birth control, any history of sexual transmitted diseases. Now, all of these questions may not be needed for every patient. So you kind of pick and choose the ones that are applicable to the current situation. Like I said, keep in mind this can be very embarrassing for the patient. So make sure that we're providing for their modesty. You know, they may not be comfortable talking about their sexual history in front of strangers or even very close family members. So you really want to limit who all's there. Teenage girls especially may not feel comfortable, probably are not going to feel comfortable talking about any kind of sexual history or activity in front of their parents or somebody else like that. Even grown women are probably not going to be comfortable with having their vagina or their breast just randomly exposed, you know, if there's family and neighbors and paramedics and firefighters and police officers and all these people around. Probably not going to be okay with it. So make sure that we only keep the necessary people there. We limit that crowd to the people that are necessary to perform the task. Now you still need one witness at least, but you want to not have a whole bunch of people just around. Okay, provide that modesty. Whenever possible, the paramedic should be the same gender as the patient when dealing with this. It's not always possible, but it's preferable if at all possible. I can remember there being times where I was the only female on shift in the entire city of Montgomery. And so anything GYN, OB, sexual assault, anything of that nature, I would go on it. When we are doing our secondary assessment, we're going to look at their abdomen, make sure that we look at it. All right, we want to look for any bruising, we want to look for any needle tracks, Cullen signs, Gray Turner signs, those things might be indicative of internal bleeding. Then we want to palpate the abdomen. We're going to look at all the quadrants. We're going to start furthest away from the pain. We're going to note, is it rigid? Is there any kind of tenderness? Does palpation make them hurt more? Is there any rebound tenderness? Are there any masses? If they're pulsating, stop pushing, the normal. Then we're going to determine our vital signs. Are there any variations in the pulse? And it should be regular and steady, right? We're going to look at our blood pressure. Is it normal, low? Is it elevated? Are there any orthostatic changes? Any differences between sitting and standing, standing and laying, or anything like that? And if there are, then we assume that they're in shock until proven otherwise. And as far as our reassessment, while we're on the way to the hospital, always recheck our interventions. See if there's any improvements or any decline in the patient's condition. Make sure that we're getting serial vitals, that we're getting more than just one set of vital signs, and pay attention to the needs of your patient. Right? You can do paperwork after they get to the hospital, but make sure that you are taking care of the patient all the way through. So let's run through a couple of quick little questions here for you. All right, true or false? So any patient of childbearing years or age with abdominal pain should be considered to have a gynecological emergency until proven otherwise. What do you think? True or false? If you answer true, you were right. The paramedic taking a detailed history of a rape incident, the paramedic should take a detailed history of a rape incident to enable the victim to vent their feelings about what happened. That is false. All right. Most rape victims are not going to want to give you a concise, detailed report of what they just went through. Okay, and if you try to get any extra information like that, it's probably going to cause them to shut down. All right. Get the minimum of what you need to treat them. We're not the police. We're not there to find out who did this and why. We're there to take care of the patient from a medical standpoint. Right, the patient who has experienced a rape should be discouraged from cleaning up before being examined in the ER, or emergency department. That is true. We want to try to limit this because it can destroy any kind of potential evidence. Right. The insertion of an IUD can increase a woman's risk of developing PID. That is true. Right. Infection that can cause the Bartholian gland to become cystic and abscessed. True or false? That is also true.